Morning, morning, morning. Good morning. Good morning to you.
The work of the Barbados National Council on Substance Abuse continues, and the month's theme this month as Drug Awareness Month is Our Workplace, Our Future, Our Future, Our Workplace. And you get it once you stop to think for just a moment of those four words: our workplace, our future, our workplace. Joining us now as we continue to look at that and the ongoing work of the National Council on Substance Abuse is its manager, Betty Hunt. Ms. Hunt, good morning to you.
Good morning, Pearson. Thank you for having me.
You're very welcome. Thank you for coming with us indeed. Every Friday we've been connecting with you as we celebrate with you Drug Awareness Month. And you know that sounds a little odd to say celebrate in Drug Awareness Month, but the work is so significant. The work that your organization does is so significant. We want firstly to salute you on the continuing efforts to bring awareness, but also to bring action within our community and our workspaces as well. So thank you very much for the work you and your officers do.
Thank you so much, and thank you for your words of support.
You're very welcome. But there's a lot that still has to happen, you know. I know this month you're tackling drug awareness within the workplace in particular, and how we should be able to spot the signs and what kinds of policies and procedures we need to put in place to be able to assist those who are struggling with the abuse of drugs. How has it been so far the month and in trying to get that message out to workspaces?
Well, so far the month has been hectic. It usually is, but we are prepared. What we have found is that still the message of drug abuse in the workplace is still treated in the traditional way. So what we have been using the month to do is try to educate not only employers, but also employees. And as our theme suggests, we are trying to get into schools and spaces where there are young people to help them prepare and to tell them of the challenges that may be caused as a result of drug abuse. In terms of reaching the employers and those who are already employed, we are trying to show how drug abuse can impact in various ways in the workplace, both at the individual level and how that can scale up to impact the company, the organization, the agency. So that is what we have been focusing on during this month.
I know that many organizations have health and safety committees, and they would think automatically it falls under that umbrella. But unless the policies are there to be able to support that particular position, you know, it's not necessarily going to be done. How is the organization, the National Council on Substance Abuse, aiding employers and to move to the point of drafting the policy, putting in place those frameworks so that you are effectively able to help those within your workplace who are struggling with drug abuse?
Well, what is surprising is that even though we found that quite a few workplaces are making the effort to incorporate a lot of the newer practices and bits of the newer legislation into workplace policies, there is not an explicit reference to drug abuse. And we understand this. It is still not covered in the way we would like it to be covered by insurances and so on. So there are myriad challenges for employers who have to deal with employees in the workplace, especially when it is a high-risk workplace situation. You have to be extremely careful how you treat two persons impacted by substance use. We have been, as you said, helping workplaces more and more develop the policies so that the language that is used in the policies is appropriate. So, for instance, we don't speak about addictions and so on, persons with addiction or drug addiction, a substance use disorder impacted by substance abuse. And so we try to change the language to make it more inclusive for the employer and to make the employee feel that there really is no shame in coming forward to say that this is a particular health challenge, this is what you're going through, and helping employers create that situation, that space in the workplace that can help employees that are directly impacted by substance abuse to seek help and to seek treatment. Those who are not impacted by substance abuse, what we do is we go in with our drug education, and our drug education is largely focused on prevention. And so we do the prevention sessions, and we help those employees, give them tools which will help them cope with situations which may lead to drug abuse, or for which the outcomes seem to be the easiest thing is, let me start using this substance to help me cope. And so we help both with prevention And we also have a counseling service to assist those persons who unfortunately are impacted by drug abuse.
Indeed, and it's a wider societal concern as well that we all need to be able
Yes,
to
ma'am.
address. I know at the launch service, we saw it on our news, where you address the church. Now, church,
Yes.
I love that. Let's talk a little bit about all the actors within society who should really be a part of this effort, and what role would you want all of us to be able to play? Could you break it down for us, the mission of the National Council on Substance Abuse, to be able to address it in all of the segments of society?
Well, you're absolutely right. This is an area where we need a whole of nation approach. This is an area where we need a deliberate approach. This is not an area where I feel that drug abuse and how we treat to drug abuse as a society is tacked on to something else. We need to normalize our conversations in the church. We're asking the churches to see how they can retool their message so it doesn't seem judgmental, so it doesn't prevent persons from coming in, from seeking help there. And churches are still a frontline community institution. So if a church is accessible, that is one thing, access to treatment. So, or to help. So if the church is accessible, we're asking the church, first of all, to be a place where somebody can find solace first. The drug prevention, the drug treatment, the drug intervention, whatever it looks like, will come after. We're asking schools to let us in, and they have been very good with that. As a matter of fact, coming up next week, we have a session not with the school teachers, not with the children. These are audiences we have been interfacing with. But we have a session for the auxiliary workers at schools
Mm,
because, quite often it is the cleaner, it may be
yes,
gardener that can see something, that can alert a teacher or so to something. And so
yes.
we hope that the response is good. We've already sent out our invitations. We want to really sensitize the auxiliary workers at schools and in and around, not only at schools, but in and around the community. As you're going to school, you're usually there first on morning. So what you see, what is different from yesterday? When you go in the afternoon to clean the bathrooms, what looks different? And so we'll be putting on that session next week. So that is schools, that is churches. In the community, we are challenging people to see, and this may be controversial. It is legal, but alcohol is also a drug. There's also a limit to
Mm,
use alcohol responsibly. And I know there's a lot of conversation about whether any drug can be used responsibly,
mhm.
but yes, it can be used responsibly. And that is the other thing we're using the month to debunk a lot of the myths surrounding drug use. Drug use is a public health disease. If we don't treat to it as such, as much as we treat to it as we provide resources for the criminal justice system on the back end, we will find ourselves in challenges not too far down the road. And so it really is a whole of nation approach. We work closely with government agencies, with NGOs, and they, in their own spheres, they really do assist and support what we do. So we tailor our message depending on who we are interacting with, where our interventions are, and what our interventions are supposed to look like. It is certainly not a one size fits all.
Most definitely not, indeed, and very well put, indeed, because I could see the whole overall effort and how we can impact society at its widest reach as well. But you're now engaged in a food and give back program. Talk to us a little bit about that and how we can all be a part of it.
Well, this is something that is close to my heart, Pearson. Actually, it came directly out of the pandemic and those first days and weeks and months when there was a total lockdown. We found that we put systems in place, and so we continued our counseling and so online. But we also found that there was a need. Some of our clients were not able to access basic food items, basic toiletries in the way perhaps that others were. We know there's already a stigma to accessing help, but there's an added layer, as it were, if the challenge seems to be drug abuse. Because there always seems to be that element of, well, using drugs, you can spend your money on something else, or so on and so on and so forth. And so we actually started with around 5 clients, 5 or 7 clients in 2020. And by last December, we actually gave out 41 hampers. And I have to say, these hampers initially were largely staff donations. When we were on the road, we found a couple of older people and so who were also in need. What I have to say is we do not do a strict means testing for what obvious reasons. We already know who we know. We
Yes.
already know who needs help based on who comes to us. And so we have tried, we have a couple of persons in the private sector who support us. But yes, we are launching a food drive at the Massey stores on the 28th. It's the last Saturday in this month. So we'll be at Whole Town, we'll be at Warrens, we'll be at Worthing, and we're asking persons as they come in, we'll give them a little list of things that we'd like them just to add in an additional canned item, some food item, bring it and place it in our box, and then we'll go back and package them and we'll be on the road again. But I really want to use this opportunity to say thank you. We have a couple of people who have dug in their own pockets because this is something that we have tried to do at the NCSA, from the NCSA and its staff and people who work really closely with us. So we really do hope for nation support on
Yes.
Saturday the 28th at the Massey stores.
I do agree with you completely. I hope everyone does. It's next week, Saturday, everybody. Today is the
Yes.
20th. Tomorrow is the 21st. So next week, Saturday, Massey Whole Town, Massey Warrens, and Massey Worthing. Those are the three supermarket spaces where representatives of the National Council on Substance Abuse will be. And they want to encourage as many of us as we go in to purchase something extra. The extra goes to supporting this food drive as well, because those who are struggling with the alcoholic conditions, whether whatever substance they're abusing, they often misjudge how they spend, and so they have a greater need that we can all as a society meet when we give to this effort. Last year, 41 hampers were distributed. This year, we're going for beyond that number, and we really don't want to have to put all the strain on the staff of the NCSA, so we can all do this, everybody. So next Saturday, the 28th of January at Massey Whole Town, Massey Warrens, Massey Worthing, all three supermarket
Yes.
spaces. That's where each of us is encouraged to purchase and give to the National Council on Substance Abuse, all part of giving back to making our society whole, yet again through the efforts of the National Council on Substance Abuse. That too is our workspace, the society. And so
Yes.
it fits so beautifully into the theme that you have, our future, our workplace, our future as well. So we want everyone to join you in this effort, and I really hope that they do. We have to leave it there, Ms. Hunt, but it was
Thank
such a
you.
wonderful opportunity to talk to you directly, to hear from you, the head of the National Council on Substance Abuse, the vision, the passion, the focus, the everything. And I want all of us really now to join hand in hand with you to assist our community be better through the efforts of the NCSA. Thank you to you and your team.
And thank you, Pearson and Morning Barbados, for giving us these spaces the past couple of Fridays. And please feel free to have us back whenever. Thank you so
Absolutely.
much again.
You're very welcome indeed. Thank you very much. The National Council on Substance Abuse next week, Saturday, is the big food collection drive, and we want as many of you as possible to give as much as you can. Thank you so much for your support.
Morning, morning, morning.